But in college, where I was an English major, a number of the professors said, you know, you should think about either grad school or law.
Right.
And while I was at Virginia, I got involved in legal aid work, which is doing free legal services on the civil side for people who can't afford a lawyer. It really felt like I was making a contribution, you know, to people who couldn't otherwise have a lawyer. But even if it was small stuff, it mattered in their lives. And I found it intellectually and emotionally satisfying. Then there came an opportunity to lead an initiative using third-year law students over the mountains in the valley where there was not a legal aid program in effect. And I was able to recruit lawyers to volunteer, and law students go in and interview the students, screen them for eligibility, and then refer them out. And I felt, again, I enjoyed that. And then when I graduated, I went on, actually went to the Roanoke Valley Legal Aid Society, which at that time was the largest legal aid program in Virginia. Got to the point where I felt like I was burning out. There was just there was an infinite demand. So I went over and became a special assistant attorney general and represented the state of Virginia and employees in all of Southwest Virginia. So anyway, I did that for two or 3 years, and then I decided I want to get into private practice. So when I came, I was a litigator, which means going to court. It was all civil stuff. Biggest clients were Preston Trucking and Maryland National Bank. So a lot of it was contracts and claims and stuff like that. Years passed, and I started getting exposed to land use work, zoning and development. And I really enjoyed that, and then got exposed to the hospital. The senior lawyer who had been there, outside general counsel, wanted to retire. He knew that the board was pleased with what I had done for them in narrower areas, and he said, why don't you think about learning hospital law? And I said, well, why not? Seems like a great idea. So I was their outside general counsel for about 15 years, and took it through the Dorchester General affiliation and then merger, took them through the development of a system, and then represented them in the affiliation with the University of Maryland medical system. And when I represented the hospital, there were a number of times when we had issues that had to do with reimbursement, because they had not only the inpatient facility, but they had outpatient facilities, and then they built up a network of clinical programs running everywhere from, you know, x-rays and MRIs to doctor's offices and so on and so forth. And every one of them has its own relatively sophisticated and complicated reimbursement stuff. And you could make a mistake and you could get into trouble. And so that piece of it is very much overlaps what I'll call the integrity side of what Qlarant does. It's, you know, they're looking at zillions of pieces of information, digesting it somehow, evaluating it, and identifying things that are suspicious. And in many cases, identify things that are just wrong, you know, and intentionally wrong. And at first, I was just kind of befuddled by the organizational structure. It was a complicated structure, and it had some reasons for parts of it that, since I've been here, we've concluded no longer had utility. And we completely streamlined the organization, I think, and cleaned up a lot of the complexities of it. I think it started as more of a traditional not-for-profit. You know, it was driven in part by, I think, some federal government initiatives to encourage quality control among healthcare providers, including specifically doctors. And it either mandated or encouraged doctor groups to come together to try to guide that. Because people weren't making money at that. They were trying to do good. Okay. You're helping government save money, and you're helping people have better quality of care. Well, over the years, Qlarant and its predecessor names became very committed to helping use some of its resources to improve health care among the underserved population. And Qlarant's doing, I think, a very good job with competitive grants good follow-up processes, and trying to make a difference with the resources they have. And I mean, when you identify a bad guy and somebody's abusing the system, and you know, that's cheating all of us. And if we can help do that and help the government, you know, stop it, maybe get some recompense, maybe punish somebody, maybe set, you know, a precedent. That I get some psychic reward from that. On the quality improvement side, you got really caring people out there in the healthcare professions, but like any other complicated delivery system, there's imperfections in how people do things, even if they're mostly well-intended. And one of the things Qlarant does really well is help healthcare delivery systems improve quality. It helps get desired results with whatever the current knowledge is. You know, if you can improve efficiency or outcomes with safety or disease management, that's huge. You know, that's really huge.